Hi, am I live now? Okay, good. Good morning or good afternoon, everybody, wherever you are around the world. It's probably about 11 a.m. here in Toronto, and thank you for coming on and giving me the opportunity to come and speak to you guys. So my name is Yasser Khan. I'm an ophthalmologist, so I'm an eye surgeon and physician. I've been an ophthalmologist for about 15 years at least, and I specialize in ophthalmology, but also I specialize in an area of ophthalmology called eyelid and orbital surgery, and that's what I do as an area of interest. And I've seen over the course of 15 years, I've seen thousands of patients with all kinds of visual complaints and visual conditions, and I've treated them, diagnosed them. And so I come at Visual Snow more from sort of an eye perspective. And, I mean, Visual Snow, as its name, is really a visual phenomena. And so that's where I come in. My introduction to Visual Snow um, was gradual. Now, I also travel the world. I've been to about 40 different countries, and I've taught and done surgery in most of these countries over the last 10 years. And so I've met a lot of people with a lot of symptoms around the world. And I do recall in many of my missions, many of my teaching missions and my volunteering missions that I do around the world, I have, I would meet people who would have different types of visual symptoms that now I know were very consistent with Visual Snow. And, at the time, I would really discount them as floaters or something like that, because I mean, we see that a lot in my practice. And it wasn't until a few years ago where I saw a patient that I examined and nothing was wrong with the patient. Had a normal eye exam, everything was fine. I could not find anything to explain his symptoms. Where he saw these floaters, a constant dots in his visual field. He would see floaters sometimes, and I don't know what to make of it as well. Maybe it's a migraine, but he had no headaches. And I almost discounted it until I paused to actually talk to him and listen to him with an open mind and try and figure out what's going on. And that was my introduction to the world of Visual Snow. And then a few years ago, I was approached by our by the main newspaper, which is a plug for the fact that newspapers and the news media are still something that we need, and we should support them. Because they do make a big difference in our lives. I know we tend to look at the news and go on social media and things like that, but I think newspapers still have a lot that they can offer, and will, I hope, for a long time. In any case, one of the reporters said that her colleague, was diagnosed with Visual Snow, and they knew nothing about it. And if I could basically talk to them about it, and so I did. And as much as I knew, as much as I'd experienced, and from then on, the rest is history, because that piece that I did with the Toronto Star was read by many people around the city, across the country, and across the world. And it really, for a lot of people, based on the comments I got, it opened up their minds to Visual Snow, and reassured them that they're not going crazy, or this is not something which is just something that only they have, that a lot of people have this, and this actually is an actual syndrome that's been established, a condition, syndrome, a disorder, whatever you want to call it. And I think that was very reassuring. And that interview and that article is actually one of the most rewarding things that I've done, because it opened me up to a world of these wonderful patients who suffer from a very real condition that can be quite debilitating. And that's the first step in trying to find a way to help these people. And since then I've seen many Visual Snow patients. I've also traveled. Last year we had the first Visual Snow Initiative global conference in San Francisco, organized by the Visual Snow Initiative. And it was a wonderful, eye-opening, no pun intended, eye-opening conference where I met dozens and dozens of patients and wonderful physician colleagues, pioneers in this field. And we got to share our knowledge, and it was wonderful. And I think that it is something we should have on an annual basis. And really, really, I think since then, a lot of research and things that happen around visual snow. So that's enough about me. Visual snow, I'll just say, is an area I'm very passionate with. I think that we're very close to really making some, huge breaks in this condition. And I really commend the Visual Snow Initiative for really leading the way in this area. So I was told, I was given some questions to answer that I'll try and answer as best as I can. And by all means, please, if you have any comments while I'm speaking, all these questions are being monitored by our Visual Snow Initiative team, and I'll basically answer these questions that were actually acquired from a Visual Snow Initiative YouTube live question and answer contest, and they're chosen by actually a random generator. So I didn't actually pick these questions, but I was given them. I think it's a nice way to start this session off. If you have any questions or any questions in addition to what I've answered, or if I've not been able to answer your questions, I'll stay around after the session's over, and I'm happy to attend to as many questions as they are. So let's go with the questions. So the first question is from Vanessa, who's from Illinois, in the U.S. And Vanessa basically says, with my visual snow, I have very prominent ghosting, or what she describes as bilateral diplopia, especially at night or when I'm fatigued. And she's always perplexed by its variability. Sometimes she says the ghosted image is above the true image, and sometimes it's below. Sometimes they overlap, and sometimes the images are completely separate from each other. The distance between the images seem to be more distance from each other as the day progresses or as fatigue worsens. Do you have any idea what causes this variability? So this is a pretty loaded question. There's a lot of things being addressed here. But obviously, Vanessa has visual snow. I'm presuming that she has the symptoms of seeing multiple dots for a period of more than 3 months, in the dark or against a white screen, which is sort of like almost like looking through an old TV screen with buzzing noise and dots in the on the screen. But she's also having what can be described as palinopsia. Palinopsia is the phenomena of seeing after images. So basically, you look at like a cell phone on your table, and you look away, and you look at it again, and you'll see a ghost image. So basically, seeing ghost images, that can be almost constant, or that can be intermittent, happening, once a day or twice a day or 3 times a day or whenever. Everybody's different. It all depends. I mean, everybody's brain is different. So it all depends on a person's brain activity. Because as you know, visual snow has been linked to hyperactivity in an area of the visual cortex in the brain. So it's a hyperactive area, and everybody has varying degrees of hyperactivity that produce the symptoms. So basically, I think that what Vanessa is describing is really palinopsia. It's a ghost image. Now, with regards to diplopia is double vision that is persistent or intermittent. So when you look at an object or a person, either at close up or distance, you see 2 images. And diplopia can be vertical, meaning the images are on top of each other, or horizontal, meaning that they're right next to each other. And diplopia, most commonly in ophthalmology, is a syndrome associated with eye muscle disorders. So whether it's eye muscle, whether you're born with an eye muscle disorder or you develop it because of various reasons or trauma, whatever, basically it has to do with eye muscle issues. And the way we treat this is usually with glasses or surgery, or sometimes time heals, especially if it's a neurological injury or paralysis of a nerve that attaches to the muscle or makes the muscle move. So that's diplopia. And I think Vanessa's describing symptoms of both palinopsia and diplopia. Now, definitely, she says that the distance between the images seems to be more distant from each other as the day progresses or as fatigue worsens, and that sometimes happens in some patients who have exophorias or different kinds of sort of muscular disorders or are tired. Sometimes what happens is when we get tired as the day progresses, we lose our ability to fuse properly, and basically because we can't fuse or focus on an image, our eyes kind of relax and our eyes kind of sort of go out, and that can also create double vision. So so basically, I think, do you have any idea what caused the variability? I think the variability is caused, it's different per patient, and I think it's to do with severity. I think the reason why it's worse at the end of the day is that we just get more tired, our eyes get more tired, and we fuse less strongly. So let's go to the next question. Is there any way to know when you'll stop getting new visual snow symptoms and just have it stabilize? I've had visual snow for 4 months and I feel like I'm getting new symptoms. This is from Joelle, who's in Florida in the US. So is there any way you know where you'll stop getting new visual symptoms? The answer to that is no. Right now, we don't have strong research showing any of these trends. We do know that visual snow can progress for sure. I mean, patients will sometimes initially get just the visual snow phenomena of seeing dots in a blank screen, which will then progress to seeing dots all the time, and then patients can develop the other sort of criteria, because basically, I mean, just to come back to those, I mean, there's been very many proposed criteria for diagnosing visual snow. One suggested criteria that was actually in a landmark paper by Dr. Godsby. I think it was a few years ago. He wrote this landmark paper on visual snow, and one of the things that's been proposed is that we diagnose visual snow by having visual snow, so having these dots in your visual field, which are typical of snowflakes, an analog screen on an old style TV. That's number one. Along with at least two of the following four things. So that's palinopsia, where you see after images or ghost images, number one. Number two, there's entopic phenomena, which is basically seeing floaters, flashing lights in your visual field, often blue colored. There's photophobia, where photophobia is basically light sensitivity. So you go outside and you're extremely light sensitive, unusually. And last is nyctalopia, which is where you get impaired. Your vision's okay in the daytime, but you get decreased vision at night, also called nyctalopia. So if you have visual snow, if you have two of these four symptoms, and you don't have any other condition or disease or disorder going on, you have nothing in your brain is normal otherwise, there's no tumors or masses, there's been no history of eye trauma, you're not on any medications causing this, and that's how it's diagnosed. So basically, if you have visual snow, anybody can progress and get any of these symptoms as time goes on. So the answer to Joelle's question is that it is possible that she may develop more symptoms like palinopsia, like nyctalopia, like photophobia as time goes on. And it is possible that the visual snow may get worse. The snowflakes may get worse as time goes on. It's just hard to assess because everybody's brain is different. Good. So let's go to question number 3. As Dr. Khan is an eye surgeon that is also knowledgeable about visual snow, what is your view on the condition from a medical perspective? What can we as patients do to help raise awareness in the medical community? This is by James from Philadelphia in the United States. So visual snow, unfortunately, in the medical community is still unknown. I think initiatives like the Visual Snow initiatives, social media, conferences, things like that article that was published in the Toronto Star's Health section that was read by a lot of physicians, I think has really opened the minds of many physicians and have exposed them to visual snow. I think the first challenge is really education. So I think that what is your view on the condition of medical? So basically, visual snow, without a doubt, is an actual disorder or almost syndrome or condition. It is real. It's to do possibly with hyperactivity in the visual cortex of the brain. So there's real abnormal patterns going on here. It's a significant condition that affects people's lives in a negative way, and so it has to be addressed. So for sure, visual snow syndrome is real. it's a disorder, it's a condition, it's a disease, whatever you want to call it. It can be a syndrome if it's associated with other things. Okay. And as far as what we can do, I really think that, I did a survey, the results of which we'll publish soon enough, to a lot of my family doctor, my ophthalmology colleagues, even optometrists and neurologists. And I surveyed them about what visual snow is and how is it diagnosed. And unfortunately, the knowledge, this was last year, was actually extremely poor. A lot of doctors, even ophthalmologists, even people in my own field, had either vaguely heard of visual snow or uh, wrongfully attributed it to having just simply floaters or something else. So knowledge is definitely lacking in the medical community as well. And this is, I think, the mission of all of us, physicians, as well as all of you, and people, the wonderful people at Visual Snow Initiative, to really get the message out. And for that, we need your support. We can't do it alone. And we need social media to be active. We need funding. We need doctors like myself and the other doctors that are coming on these YouTube feeds to come and talk about visual snow, and I think the message will get out. I think that a lot of us are presenting at medical conferences. I will be as well, about visual snow, and I think all that will help. But definitely, we need you guys to get out, talk to your doctors, take the articles, take the literature. Articles like the ones in the Toronto Star where I was interviewed. But there's other articles as well. Take that to your doctors. Let your family doctors, let your eye doctors, let your neurologists know about this. And I think that'll help a lot. Okay, so the next question is by Carlos, all over Mexico. So Carlos says, some people say that SSRIs, which are basically SSRIs, are antidepressant drugs that we give people for depression and other psychiatric conditions. Some people say that SSRIs worsen or even cause visual snow syndrome. Would you recommend someone with visual snow syndrome and a comorbid psychiatric disorder like depression, anxiety, OCD or obsessive compulsive disorder, etc., to take SSRIs for their mental illness, or is the risk of worsening visual snow greater? So, first of all, as a physician, I would advise all patients in general, no matter who you're seeing, whether it's your family doctor or your psychiatrist, whoever, do not stop any medications ever without consulting your physicians, especially consulting the physician that actually prescribed the medication. But if you have no access to him or her, then whatever you do, do not stop any medications without asking your physicians. So in this case, off the bat, do not stop your SSRI just because you think it may cause this, that, the other, without consulting a physician, without making him aware, and without working with him on this. As far as SSRIs or antidepressant medications causing or worsening visual snow syndrome, there's basically absolutely no evidence for that. That I've seen in the literature. There's research ongoing, but we've not been able to establish a solid link at all, for this. And definitely, you can ask your physicians and your family physicians or your psychiatrist about this, but there's actually no link that I know of that they can worsen it. I mean, mental illness is a big issue in the world. These days, it's often untreated, underdiagnosed internationally, and it can have a huge effect on people's lives. So mental illness should be taken seriously and should be treated first and foremost. So I would not stop any treatment, anything you may be on for mental illness. I mean, definitely, if you visit the Visual Snow Initiative website, it's www.visualsnowinitiative.org. You'll definitely find more information on this as well, including the diagnostic criteria. But for sure, don't stop anything without talking to your doctor. And there's no evidence that they can worsen or cause visual snow, as far as I'm concerned. In fact, they may worsen if you're not on this medication because you'll have other, morbid conditions acting up, and so you won't know what's going on, whether it's a visual snow or it's some kind of mental illness. Okay. Both are two separate things. Okay, 5 is by Christy from Michigan. Do you know of any medications that make visual snow better or worse? What causes visual snow to progress? So I've kind of addressed this somewhat, but I will address it again. As far as I know, People have talked about different medications like the SSRIs. I mean, there's some stuff out there that they make things worse. They may make things worse. But to be honest, there's really, as far as I know, there's really too much. To the best of my knowledge, there's really no medication out there that has been directly linked to making visual snow worse, as far as I know. And what makes visual snow better? There's a number of medications that we've tried. I mean, certainly, a medication where there's called Rapamil, which is used for migraine, has been known to basically at least help the migraine, but also help some visual snow symptoms. There's there's been also medications like I had one like lamotrigine, which is an anticonvulsant, anti-epilepsy medication, and that's been shown in 1 or 2 studies only, and there's still more research going on to alleviate some of the symptoms of visual snow. Dimox, which is an anti-blood pressure pill, brings the blood pressure down, has also been shown to cause some relief. But again, I think these are some medications that are worth trying in consultation with your physician, because they all have side effects, to see if they make a difference. But they have been shown. Other things like there's been some benzodiazepines, which are basically relaxing, anti-anxiety, sleeping medications that have also helped some patients calm their visual snow syndrome symptoms. Other things that are, here in Canada, of course, cannabis is legal, and so definitely CBD, cannabis oil, has been shown to really help a lot of patients. And I know at least 3 patients in my practice that have taken CBD or cannabis oil, and they've had wonderful results. Now, it doesn't cure the visual snow, but definitely does make them feel better. And I mean, depending on where you live, I don't know how, I guess in the US it's state by state. I don't know how it is internationally. I know in Canada it's legal now since October of this year. So CBD oil is easy to get. And I think most places for medical reasons will allow, CBD to be used. And I think that's made a big difference in some patients as well. Okay. So number 6 is by Dominic from the Czech Republic, I believe. And Dominic writes, I recently tried clonazepam and it removed all my visual snow symptoms for 8 hours. Do you have any idea why I experienced this? First of all, Dominic, that's fantastic that you were able to find a medication that worked. Clonazepam is a benzodiazepine that is one of the most common prescribed medications to help us sleep. In low doses, it can also help us relax. So it's an anti-anxiety medication, but also it's mostly given, around here to help us go to sleep, for those who have trouble sleeping or are really stressed for whatever reason. And, since visual snow is a hyperactivity condition, and there's some hyperactivity going on in the brain. So, I mean, giving a benzodiazepine or an anti-anxiolytic or anti-anxiety medication to relax us, it makes sense that it would, in some patients, potentially cause symptoms to go away. Now, Dominic doesn't mention whether these 8 hours was while he was sleeping or not, but because clonazepam is something that makes us sleep. But I think just relaxing visual stimuli, relaxing their brain is probably how it most likely works, although, we don't really know exactly. So number 7, so this is something I mentioned early on, is from Lars in Germany. So Lars mentions, what are the effects of lamotrigine on visual snow? Should I try it? So lamotrigine is an anticonvulsant medication used for epilepsy, for seizures. It's sometimes used for, bipolar disorder, where you get manic and depression. So, I mean, it's not a benign drug. It does have its side effects. It has been shown in at least one case report or one study to make a difference. There have been others that have used it since then with varying results of working or not working in, decreasing your visual snow symptoms. But definitely, I would consult with my physician. And I think that if I think making a contract, trying it out for 3 months and seeing that makes a difference is worthwhile, because it has been shown to work in a few people at least. And I think that as long as you know the side effects, as long as you monitor closely, I think it's worth trying. But it may or may not work. Number 8, Dr. Khan, how close are we to some sort of treatment for visual snow? So this is from Casey from Houston, Texas, in the United States. So I believe, Casey, that we are very close. I think that we're very close. There's a lot of research going on. The Visual Snow Initiative, the whole team has done the most, as far as I know, in really progressing this condition and really putting it out there internationally. And so I really sort of commend them for doing that. I think that we're very close. I think there's a lot of progress going on in devices that can decrease visual snow. There's first of all, there's increased awareness. I mean, people know about this, and and I'll tell you a story if I can just kind of pause here just to regroup. I specialize in a condition called blepharospasm and hemifacial spasm. So it's a condition that is actually not common, but in my practice, it's very common. I probably have one of the largest practices around here of seeing patients with blepharospasm or hemifacial spasm. Blepharospasm is where a patient blinks like this uncontrollably, and they can't stop blinking like I am doing right now. And it can be quite debilitating. You can't drive, you can't read, you can't see because you're going like this constantly. Hemifacial spasm is where they get a twitch like this, like that, constantly. And it can be quite debilitating because if you can imagine having these spasms constantly that are progressive potentially. So about 40 years ago, we had no cure for this. Actually, most doctors did not know. A lot of these patients were admitted to psychiatric hospitals. People thought that there's something wrong with them, that they have a mental illness. People thought there's something wrong with their eyes. It's dry eyes. We would give them drops. We thought that there's a tumor in the brain. There's all these misdiagnoses. A lot of doctors did not know. And even to this day, once in a while, I see a patient who's been through 4 or 5 different doctors when finally I make the diagnosis and I treat. So it took a long time for this disease or condition, blepharospasm and hemifacial spasm, to be properly diagnosed. And it all started first with education. So a lot of doctors, like optometrists, eye doctors, neurologists, family doctors, did not know about it, but were educated. And that took time. That took a lot of funding. There's an organization in the States in North America called the Blepharospasm Research Foundation. And they basically started the whole fundraising and awareness drive, exactly as the Visual Snow Initiative doing in modern times. Back then, we had the Blepharospasm Research Foundation, which still exists and is still doing a lot of good work in funding research for this disease. And they put the message out and really, really encouraged doctors and the public to work together to find a cure or a treatment, at least, for these conditions. And it did work because in the 80s, we discovered Botox. And we discovered that Botox really was effective in relaxing these muscles that blink like this. And actually, it wasn't a cure, but it was a treatment. And so these patients, for the first time in their entire lives, had relief. And it was tremendous. And so even now, I see hundreds of patients that come into my office every 3 months for their injections, and they live normal lives for the rest of the 3 months. Some people are actually cured. And there's still research going on. But, it took funding, and it took time, commitment, and of course funding. And that's why I want to, I was talking to the Visual Snow Initiative people and team, and they have a CrowdRise fundraising campaign going on right now. And it actually ends November 30th, which is today. And basically, their goal is to raise $50,000 for visual snow awareness and research. And this will be matched dollar by dollar of up to $25,000 by a private donor. So there's actually a donor who will match this donation, and we're almost on track for this. But we do need funding, and because I've seen it work in other conditions, and I know it's going to work with Visual Snow Initiative because visual snow is a condition that people are now finding out about, and I see the same trajectory that happened with blepharospasm happening with visual snow, from education, awareness, to funding, to research, to treatment, and to hopefully cure. And so I really encourage you guys to go on. I think I've got a link here. I wrote this down here. I think they'll tell you what the link is, but you can get it on the Visual Snow Initiative website. And any amount helps. A small amount, large amount, whatever you can give, I think it will make a big difference. Okay. So I would really encourage you to go ahead and do it. But I do think that there is hope, and I think we're very close. 9, is there anything my eye doctor can do to help with my visual snow? Alternatively, what is the best kind of doctor specialist I should see to help me manage my symptoms until a cure is found? This from Selma from Italy. Well, of course, I think first of all, I think your eye doctor, for example, yeah, because because it's a visual phenomena. I think your eye doctor can do a lot in the sense that they can diagnose you. They can examine your eyes, make sure that there's nothing else going on, make sure you have a normal eye exam, make sure your retina, the back of the eye is okay, make sure there's nothing else going on. They can educate you, especially if they know what visual snow is, about what visual snow is. They can reassure you that there's nothing bad going on with the eye, that this is a real thing, and that that you don't have anything else to worry about besides the visual snow. And also, if they're knowledgeable, and please by all means take some articles, take some literature to them, introduce them to the Visual Snow Initiative website, just so they can learn more about this real condition. They can help a lot, actually. And also, once they know what helps, what doesn't help, they can recommend things to you. They can make sure that your eye prescription is maximized. They can prescribe tinted lenses. They can prescribe a lot of different things, including medications. They can actually give you access to the healthcare system and refer you to a neurologist or another physician that can prescribe some anticonvulsant medications or antidepressant medications, etc. What is the best kind of doctor and specialist I should see to help manage my symptoms? I definitely think you should be seen by an eye physician, an ophthalmologist, just to make sure the eye's okay. I think a neurologist is very, very important in this as well, to make sure that the brain and the whole nervous system is fine. Beyond that, I think a neurologist and ophthalmologist are essential, in my opinion. I think that after that, following up or keeping in touch with and on a regular basis with a very supportive and knowledgeable family physician or primary care physician is very important. The last question, number 10, is from Jane in London, England. How can I participate in visual snow research? Well, Jane, that actually is a really nice way to end off these questions. I think that there's a lot you can do. The first is donate. I think donating and supporting, not just donating, but giving your time, promoting it on social media. I mean, there's more. I mean, donation is not just money, although money does help. Money does talk, as the saying goes. Of course, funding is very important, but also it's awareness, it's knowledge, it's education. Spending time on social media to sort of pass along information about visual snow, educating your physicians and your colleagues. And of course, if you go on the Visual Snow Initiative, you'll be aware of all the studies that are going on, so that you can, potentially participate, because there are research studies going on using different devices and different medications, and definitely be really good. We all need to work together for you to go ahead and be able to participate in these studies and also spread the word. And I think that's our question period. Before we conclude, I just want to, I conclude and I address some questions that are out there. I just want to again emphasize to all people out there who are suffering from visual snow, with their families and their friends, in that I think the first thing is that you have a real condition that can be quite debilitating. So you need to be strong, confident, and have the support of your family and your friends and your physicians, and just be optimistic in that there is a cure. This is not the end. We have found treatments and cures for many conditions, and I think visual snow is something that will definitely find something for sure. I have no doubt in my mind at all that there'll be either a treatment or a cure or some kind of way to help all these patients suffering from it. And know that internationally, and I've seen it, you are not alone. There's a whole global community in every corner of the world. I've had emails and messages from at least 20 different countries of people suffering from visual snow. So there really is a really strong group, and I would encourage you getting in touch, all of you guys getting in touch and communicating, because sometimes some things work for some people and some things don't work for others. And I think sharing all that is very important. I also, I want to take this opportunity to thank again all of you guys for coming in, spending your time with me and listening in. And I want to thank the 10 people that asked wonderful questions. I also want to thank the Visual Snow Initiative and the whole team for everything that they're doing, and encourage them to keep the fight going. I'm very optimistic. And I think we'll, at this point in time, I'll go to my live feed, and I'll answer any questions that people have or may have. Okay, so I will try and go through these questions. There's actually a lot of questions, which is great. I'll try and go through these questions as you know as efficiently as I can. So this question one, Dr. Khan. I've heard a theory that visual snow could be caused by incorrect occipital emptying. Know anything about the study or claim? No, I don't. Incorrect occipital emptying. So the way I look at that is I mean, definitely in the occipital lobe or the visual cortex, there is hyperactivity going on, and so I think, yeah, I think what you're trying to really say is that it could be caused by an imbalance in the visual cortex at the neurochemical level, and yes, that can potentially. Question. I have visual snow, but I have issues related to with losing focus. I have issues focusing on objects. It is like I look at the infinite. Is it related to visual snow? I mean, first off, if you have trouble focusing, I would make sure that your glasses and your prescription is maximized, and that you don't have a more of an organic or like a physical problem with your eyeball or with your vision going on. Once that is ruled out, I mean, definitely visual snow is a syndrome. Really, is visual snow plus other things going on. So I think definitely if you have visual snow and you have basically focusing issues or after images or something like that, I won't be surprised if it's connected. But you should rule out first any other pathology going on with your eye or in your brain. Next question. Do you have any recommendations for coping with severe palinopsia? Severe palinopsia is a very difficult thing to address. I think definitely following up with your neurologist and trying medications like anticonvulsant medications or antidepressants or even something like verapamil, I think might be a first step. The other thing would be to even see your ophthalmologist. I mean, and make sure it's not diplopia because of some eye muscle disorders. And sometimes as ophthalmologists or optometrists, we can put prisms in our glasses to basically help focus the image. I'm not saying it's going to necessarily help because palinopsia by definition is a ghost image. I would actually first just make sure that you actually it is palinopsia, and then make sure your eye is okay, and maybe even ask your optometrist if they can do something with prisms in your glasses. Question by Cody. Is there a connection between visual snow and muscle twitching? No, not that I know of. There's no link. Muscle twitching itself, as I talked to you about with blepharospasm and hemifacial spasm and other twitches, is a separate phenomena. Right now, there's no evidence that I know of where visual snow itself is linked to muscle twitching. However, we're still finding out more about visual snow, and that's why hence the name visual snow syndrome. Syndrome implies that it's not just visual snow, but there's other things going on. So will muscle twitching be part of the syndrome? Perhaps, but definitely there's no direct link that I can see, that I know of. Would you recommend, next question, would you recommend trying neuromodulation like RTMS and TDCS? Do you think neuromodulation will have a place in visual snow treatment? Neuromodulation is a very specific type of treatment, and I think that it's been tried in blepharospasm as well, and so some of my blepharospasm patients have traveled all around the world, for neuromodulating therapy, where you use your brain to try and modulate your neurological system, and with various exercises, and so it has worked to varying degrees, but definitely jury's out there. But I think it's worthwhile trying. But there's no evidence for it to actually work yet. Okay, I think let me see if I can go through some more questions. So the question, do you think people who have visual snow from birth have a worse chance of getting a cure? No. About 25% of patients have visual snow that they've had all their lives. I mean, many patients will basically, come in and say, you know what, as long as I've known since I was a child, I've always had this, and I thought it was okay, but I've always had this since a child. In fact, I had one of my patients was a young father, about 38 years old, and he basically said that he knew this all his life. He had this, and it was never diagnosed. And actually, his son has it as well. And so when the dad was diagnosed, his son started saying, "Listen, Dad, I'm seeing these symptoms." And his son had been saying this for a long time, but they just ignored it. So when the father got diagnosed with visual snow, they went back and indeed the son also had, and his son was about 8 years old or 7 years old, also had visual snow. So they both did. But as far as a worse chance, no, I don't think so. I think once you have visual snow, there's nothing out there that I know of that says that whether you've had it for 50 years or whether you've had it for 5 years, it makes a difference in finding a cure. In fact, the longer you've had it, I guess people adjust, especially if you've had it in childhood, you just adjust so it bothers you less. And so these people probably don't present as much because they're bothered by it less. The majority of people do get it after age 20. And those are the ones that are affected the most because it's a new change in what was before. When you're a child, you get used to it and you just accept it as your normal. Can floaters activate visual snow? Can removing floaters help me get rid of visual snow? No, floaters do not activate visual snow. And removing floaters is a very difficult thing to do. It's either surgery or laser and doesn't always work. So I wouldn't recommend that. And unfortunately, it's not going to get rid of your visual snow. I'm just waiting for the question to load. So have you heard of people looking at computer screens or phones getting seizures if they have visual snow? Now, I know that some people who have seizure disorder, which is different from visual snow, can get a trigger, or their spasms can be triggered by looking, at a phone or looking at a computer screen. That can definitely happen for sure. But as far as if they have visual snow, not that I know of. There's a question about floaters and vitrectomies. A vitrectomy is a serious intraocular procedure. By the way, those who don't know, a vitrectomy is sometimes done in patients who have floaters that are basically bothering the heck out of them. I will only recommend floaters. I live with floaters. I've got floaters. I've had floaters because I'm very nearsighted. I've had floaters in my eyes since I was 6 years old. So I've lived with floaters, so I know what floaters are all about. But vitrectomy is a serious intraocular in the eye procedure where the surgeon goes in and removes what's called the vitreous from the eyeball, and that hopefully removes the floaters. Now, that procedure itself can have a lot of side effects, potentially a risk of infection, risk of swelling, risk of visual loss. Now, those are very uncommon, extremely uncommon, but they can still happen. And it is an invasive procedure. You're operating in the eye. So what I tell my patients is that unless the floaters are really, really bothering you and they're destroying your life, you can't live, you can't read, you can't eat, you can't, it's really affecting your life, then consider going for it. Otherwise, don't do it. But now, in the last few years, there's a special laser that's also been, is out there that can actually, focally pinpoint the floaters in the back of the eye and break them down. And that has worked with varying results. So the question is, are we seeing our neurons firing, or what is the static? Well, it's basically hyperactivity in the brain. And yes, I mean your neurons are firing at a very hyper state, and that's what's causing most likely changes in your visual cortex to see what you see in visual snow. So if there's no more questions, I want to again thank you guys. Wonderful questions. Please keep keep this energy and spirit going. These are your eyes. It's your life. It's your condition. And I think together we can find a solution for this. Thank you so much. And thank you, Visual Snow Initiative, for organizing this.